Start on.
Welcome everyone. Thank you for joining us for today's webinar. Myself, Mr. Anand Isaac, Assistant Professor, Department of Medical Surgical Nursing, Sarvodaya College of Nursing, Bangalore, as moderator for today's webinar. Today, we are conducting an international webinar on account of International Infection Control and Prevention Week. And our resource person for the day is Ms. Susan Shaila Abraham, Director of Nursing, Hamad Medical Corporation, Doha. As there is limited capacity on Zoom, I request the participants who are unable to join on Zoom to join using the YouTube link shared. Please keep your audio on mute. If you have any questions during the presentation, please type them into the chat box. I'll bring them up at the end of the presentation, and we will also have time for questions at the end. Now, without further ado, let's start. I call upon Mrs. Angela Maria Rosario, Vice Principal, Sarvodaya School of Nursing, to welcome the gathering.
We are made for goodness. We are made for love. We are made for all of the beautiful things that you and I know. We are made to tell the world that there are no outsiders. All are welcome. A very good afternoon to one and all. I, Angela Rosario, on behalf of Sarvodaya Institution, is honored to be welcoming everyone to this international webinar on infection control, preparedness for COVID-19. Leadership is not about titles, positions, or flowchart. It's one's life influencing another. It gives me great pleasure in welcoming our speaker, Ms. Susan Shaila.
Hello, good evening.
Ms. Susan Shaila Abraham, Director of Nursing, Corporate Workforce, Hamad Medical Corporation, Doha, Qatar. I welcome you, ma'am. Education is the foundation upon which we build our future. On this note, a hearty welcome to our chairman, Mr. V. Narayanaswamy, and our managing directors, Mr. Sunoj Matthew and Mr. George Thomas. I welcome you, sirs. Success is a result of perfection, hard work, learning from failure, loyalty. At some point in life, we need guidance. And with our principal, Dr. Dinesh Selvam, we are guaranteed to be guided in the right direction. A sincere welcome to you, sir.
Welcome.
Confidence comes from hours and days and weeks and years of constant work and dedication. It gives me immense pleasure in welcoming our Vice Principal, Professor Jolly Joseph, and Associate Professor Ramya Ma'am, Nursing Program Coordinator. I welcome you, ma'am. We don't have to engage in grand, heroic actions to participate in the process of change. Small acts, when multiplied by millions of people, can transform the world. On this quote, a big hearty welcome to all the participants for this webinar. Last but not the least, we are what we repeatedly do. Hence, they say, excellence is not an act, but a habit. Our teaching and non-teaching staff have always shown dedication in whatever they do or ask to do. A warm welcome to all the faculty of Sarvodaya institutions. Thank you, one and all.
Thank you, madam. Next, our beloved principal, Dr. Dinesh Selvam S., is going to address the gathering. I heartily welcome you, sir.
Good afternoon to one and all who have gathered for this another webinar. This webinar is an international webinar in order to mark the World Global Infection Prevention and Control Week. And I have to get wishes from our chairman, Mr. Narayanaswamy sir, and our managing directors, Mr. Sunoj and Mr. George. It is all their continued effort and encouragement which makes Sarvodaya College of Nursing and School of Nursing, the group of institutions, to keep on conducting the various programs so that the students are being enlightened with what's happening globally and knowing the importance of each and every important health days. And also they take informations from very good experts who are there in that particular field. So this all are because of the blessings of chairman and the managing directors, which I have to mention. Without their motivation and support, we will be not able to keep on going. And of course, all my team, my faculties and my PG students and UG students who always listen to me with more enthusiasm, which makes us keep going. So apart from all this, something about international prevention and control week. Actually, infection prevention and control, World Health Organization says it is a practical and evidence-based approach in order to prevent the patients and also the health workers from being harmed from infections which are avoidable, mainly as a result of antimicrobial resistance. This is what WHO says about infection prevention and control. But though it's a global challenge, I can say, where the measures have to be taken on individual basis and from the health workers and from the society and international levels. So this infection prevention and control and the role of nurse is too much, where they are being given the more weightage in order to prevent this healthcare associated infections, like educating the patients, families, and ensuring hygiene and supporting the entire medical team in the particular hospital. And now where we are witnessing brutally this COVID-19, where doctors and healthcare workers themselves are getting affected or being the victims of this healthcare associated infections. So when things are like this, to know more about the infection prevention and control, we have an eminent person who is apt to talk about this. That is our Miss Susan Shaila Abraham. So apart from being professionally, personally, she is my very good friend, my well-wisher. I am very happy wholeheartedly to have her in the panel. And as soon as I asked, she agreed, even though she is having a very busy schedule. You know the role of the director at workforce, mainly in a big Hamad medical corporation. I am really very much thankful from the management side also. We are very much thankful for accepting, first of all, and it's going to be a delight for everyone, because the experience what you have put in your field is going to help the participants who are listening the present today's conference in a much way. There is no doubt about it. It's very warm to have you, Susan Shaila. I am very happy. I don't know how to say in words. Really very happy. And without any delay, I think we will go forward. Mr. Anand, continue.
Thank you, sir. Now, I request Professor Jolly Joseph, Vice Principal, Sarvodaya College of Nursing, to introduce our resource person for the day.
Good afternoon, everyone. It's my proud privilege to introduce our resource person for today's international webinar. Ms. Susan Shaila Ibrahim is an epitome of professional experience with strong interpersonal skills. She had completed her bachelor's degree and master's in pediatric nursing from Dr. MGR Medical University, Chennai in 1998 and 2006, respectively. She has also completed certificate course in healthcare in quality management, postgraduate diploma in hospital administration, and certificate course in medical tourism. Talking about her work experience, she had worked as clinical instructor in Florence College of Nursing, Bangalore, and as principal in Ebenezer College of Nursing, Bangalore. Later, she had moved to Qatar, worked as head nurse for 7 years, after which promoted as Director of Nursing at Hamad Medical Corporation, Doha, Qatar. She had carried out various research projects and presented scientific posters on improving patient safety and satisfaction and effective communication. She has various achievements added to her professional career, She has carried out various project works in hospitals, has received certificate of appreciation for commissioning of pediatric inpatient unit in Al Wakra Hospital, has published articles in various nursing journals, worked as organizing committee member for 3rd Pediatric Nursing Leaders Symposium, and worked as a member of JCI accreditation at Al Wakra Hospital. Madam, we are truly blessed to have you with us today. I wholeheartedly welcome you once again and request you to take over the session.
Thank you. Thank you, Jolly. Thank you, Dinesh, for the wonderful welcome. And I'm really overwhelmed with all your wishes. And it's a delight to see my friend Dinesh. I can never say no to him. Okay, so that's great. So good evening, one and all. Respected Organizing Committee of Sarvodaya College of Nursing, dear students and faculty of Sarvodaya College of Nursing. So before we start, I have an icebreaker. So just for, just to warm up everybody. Okay, so it's just an icebreaker game. It's a zoomed in picture. So you have to guess what's the picture. I know, like, if I'm going to ask you all to unmute for a while, for just a second. Okay, can you guess the picture? Okay, the picture is, okay, so that was the answer. So now we have one more. So that's a zoomed in picture of something. If anybody can guess. Oh, okay. Nobody could. Okay, so one last one. Okay. Any guess?
Watch.
Headlight, man.
Watch, headlight. Okay. Let's see. Wonderful. That's wonderful. Good job. Okay, that's great. So without much delay, let's go to the presentation. So I'll be just having 2 sets of slides. The first part is for the basics of infection control, and next about the COVID-19 preparedness, what we did in Hamad Medical Corporation, because as you all know, it was a challenging time for all of us. And then we had a lot of issues with finding the workforce, putting together a lot of efforts to fight the COVID-19 together in Qatar. So let's see first the basics of infection control, and then we'll go to the detail. So I'm just sharing the screen, just a second. Sorry, I'm not a good techie. Sorry for the delay.
No, we were able to see it, Susan, actually.
Okay, no, I'm just trying to share the basics. Yeah.
Yeah, it's okay now.
Thank you, Dinesh. You always help me out. Yeah, okay. So we're just going to see the basics of infection prevention and control. As you all know, infection control is the responsibility of everybody. You just can't say, I'm working in a hospital. I just can't say that infection control is only the work of the infection prevention control team. No, it's the responsibility of everybody. So now I know it's just the basics, because before we go into the COVID-19 preparedness, I just want you all to just brush up your infection control knowledge. So it's one of the international patient safety goal. So you all know that in JCI, we have international patient safety goal. And this is goal number 5, which is about reduce the risk of healthcare associated infection. So if you see, germs are a part of everyday life and are found in everywhere around, like air, soil, water, and in and on our bodies. Only a small portion of germ is known to cause infection. So this is just basic. I know it's going to be boring, but just wanted you all to brush up your infection control knowledge. So how does an infection occur? It occurs when germs enter into your body and then it is increasing in number and cause a reaction to the body later. So there are three things which are necessary for an infection to occur. That is a source, a susceptible person, and transmission. So what can be a source? A source can be any infectious agent or virus or bacteria or a microbe. And then the healthcare setting, germs are found in every place. So I working in a hospital, like if I was working, I'm just as Dinesh was sharing, like I was working initially in a pediatric setup. So in a pediatric setup, you will have a lot of people entering the hospital. You have the parents of the children, you have the healthcare workers. So when we see a patient, we always predict that this patient has got an infection. So we have certain precautions, what we follow, which is called the standard precautions. I'll just take you through the slides, to the slides for that. Okay, so that is a susceptible person chain, which you all know, that is an infection control chain. It has got a portal of entry and then a portal of exit. And that's how, from a susceptible host, how the infectious agent goes into a person and what is your involvement as a nurse or a healthcare worker. And okay, so when the germs, one thing what we need to know is germs don't move themselves. It depends on people to be carried. That's why we call cross-infection. That's why we have barrier nursing techniques. So before we go into that, as per the WHO, we have 5 moments of hand hygiene. So it is 5. Why is it called 5? Because there are 5 things you remember. First is before touching a patient. And second is before doing any aseptic procedure, like inserting an IV or any other aseptic procedure. And then after exposure to the body fluids of the patient. And then after touching a patient or after touching patient surroundings. So that is the 5 moments of WHO. I know you all know about it. And the next one, I want all of you to demonstrate. I'm just going to demonstrate and I want all of you to do this. Okay, if you all can switch on your video and I will just demonstrate hand wash. Okay. Can you all please switch on your video and do with me? Okay, great. Yeah. So we have a sanitizer here. Okay. And I'm just going to take adequate amount of sanitizer and then you rub this way. Okay. And then your right fingers over your left. Okay. And then you do this. And then with your nails, interlace your fingers and do this. Okay. And then your thumb, your left thumb, your right thumb, your nails, and then wash away. Or if you're using a sanitizer, just make sure that it's dry before you touch the patient. So this is a hand washing and hand rub technique, what we adopt in the hospital, and it is worldwide, which is by WHO. Going to the next slide, that's again the hand rub. I already covered it. Okay, so now, just as I told you, the standard precautions, the precautions are 2 tiers. One is the standard precautions, what you take, which is for any patient who comes into your unit. So we just have to, understand the fact that the patient coming in has got an infection. So regardless of whatever the disease, we need to take the standard precaution. And then the next is a transmission-based precaution that is based upon the transmission of the disease, like airborne or droplet, okay, or contact. So the standard precautions we use that's why, just as I told you, we consider all patients are infected. And it includes performing hand hygiene and using the PPEs, ensure appropriate patient placement. That is about, I hope you all know about the patient placement. That is the distance between 2 infected patients, like what is the distance you maintain. And then the laundry, handling the laundry careful. I'm just talking based on the hospital background. That's why I talk about the laundry and all that. And then following the safe injection practices, because we have proper handling of sharps, that is the needles, and following the proper cuff etiquette. So in our hospital, what we do is the cuff etiquette. What we practice is we cough into the elbow. We don't cough on the face or in when you're standing in a gathering. So we always cough to your elbow. So that's a cuff etiquette what we use. And then routine cleaning of the waste management, proper waste management. So that was a standard precaution which you saw before. And now the transmission-based precautions are contact precaution, droplet precautions, and airborne precautions. I'm not going to go into details on this because we have to cover the COVID-19 preparedness, what we do from the infection control view. So, and now for in a healthcare settings, what are the PPEs we commonly use? First is the gloves, which all of you know, it is to protect your hands. And then the gowns, which will protect your skin or clothing, mask and respirators, which will protect your mouth and your nose, and the goggles, which will protect your eyes, and the face shield, which protects your face, mouth, nose, eyes, etc. And now there is a sequence for donning. Donning is how you put on the PPEs. So there's a sequence which we follow. First, we put the gown, and then we put the mask, then we put the goggles, and then we put the gloves, and then we go to the patient. And in the same way, we have a sequence for removing or doffing. That is, first you remove the gloves, then the face shield, then the gown, and lastly the mask. So this is a sequence what we follow in our hospital. And again, in every hospital, there are hospital policies. So in the hospital where I work, we have hospital policies for infection control, we have policies for hand hygiene, and we have policies for patient placement. So this is how we do our practices daily with our patients. So now we'll go to the COVID-19 preparedness, what I'm going to tell you. So as you all know, COVID-19 was an unprecedented or unexpected thing which happened, and we really had a tough time in Qatar here because finding out the right resources and finding out the right manpower, it was really a difficult situation for us. So I'll just take you through the slides of COVID-19 preparedness, what we did in Qatar. Okay, just bear with me for a while. Just getting the slides ready. Okay. So I would like to disclose, because this is our hospital policy, like we're not allowed to disclose anything about, like I'll just read it out. I hereby disclose that I do not have any relevant relationship with any commercial organization to influence the content of this activity. And the objectives of this is that at the end of the session, each participant will describe the different case definitions, implement the recommended infection prevention control measures, and what is the discharge criteria for COVID-19 patients. Now, just to give a background, I know all of you are aware about it, but just to give a background, this was found in a seafood market in China, and that's when the outbreak happened. That was on 1st of January 2020. And then just to say about coronavirus, it is an enveloped non-segmented RNA virus. The name, all of you know, the name of corona comes from a Latin word meaning crown, and it's zoonotic, meaning they are transmitted between animals and people. And several non-coronavirus are circulating in animals that have not yet been infected human beings. So common human coronavirus include two types. One is a SARS coronavirus, and the other one is a MERS coronavirus. Now, going forward, the novel coronavirus is a new strain of coronavirus that has not previously been found in humans. And just because it was in 2019, they named it as COVID-19. On January 30, WHO declared the outbreak to be a public health emergency, as we all were part of it. And moving forward to the risk factors of COVID-19, you all know that the severity can even lead to death, and it is fatal in older age people, and also with patients having comorbidities like diabetes, hypertension, or cancer. And cause of death due to progressive respiratory and multi-organ failure. And during these times of COVID-19, I have personally seen, because we were all deployed for COVID duty, and we personally seen people struggling with COVID-19 and how it progressively affect them, starting from the respiratory and then multi-organ failure. I've seen it, and it was really dreadful. Yeah. And so how does COVID-19 spread, or how is it transmitted? It is through contact and then through droplets. Okay. So you all know that it is a droplet infection, and it can be infected from, that is why we have the social distancing and wearing of masks. We don't shake hands and all these things. So we keep at least a distance of 1 meter from a person, so that we're not getting contaminated. And WHO finally told that it is airborne, and then that's initially we had challenges, like we never knew whether it was airborne, so we weren't using masks, and later on we get the confirmation from WHO that it is airborne, and that's the time when we started really using N95 masks and all that here. And okay, so this is a common question which everybody can ask, like, can COVID-19 be caught from a person who has no symptoms? Yes, you all know that, of course, it can be, even the person can be without any symptoms, but still it can be contaminated, or it can be transmitted from one person to another. Okay, so you all know what are the symptoms of COVID-19. So I know you don't need any infection control protocol. You can read from the newspaper. It's common. So the symptoms are fevers and chill, cough, shortness of breath, difficulty in breathing. Some people, develop symptoms which, they just feel like they're not well, and lethargic and fatigue. And what is the difference between influenza and COVID-19? So now, we have flu vaccinations in our organizations. So people just ask us this common question. See, we are already vaccinated for COVID-19. What is the use of getting an influenza flu vaccine again? So this is the answer. You have to still get an influenza flu vaccine, because influenza flu is caused by the influenza virus, and coronavirus is caused by either SARS coronavirus or the MERS coronavirus. So the laboratory diagnosis is, first one is the lower respiratory tract, that is a bronchoalveolar lavage tracheal aspirate. So you collect 2 to 3 ml into a sterile, leak-proof, screw-capped sputum collection cup or a sterile dry container. And the next one is from the sputum itself, that what you need to do is have the patient rinse the mouth with water and then expectorate the deep cough sputum directly into a sterile cup. And then the laboratory diagnosis is again by the upper respiratory tract, the nasopharyngeal swab and the oropharyngeal swab, which we do, and the nasopharyngeal wash or the nasal aspirate. And when collecting diagnostic respiratory specimen, the healthcare worker in the room should wear an N95 mask, an eye protection, gloves, and a gown. So what we do is, when we're doing a procedure like this, we limit the visitors and we limit the healthcare workers. We just have one healthcare worker in the room to do the procedure, and we don't let the visitors come in as well. And it is not done in a normal examination room. We do it in a specific room with the door closed. And we also have specific disinfectant procedures for the room to be cleaned properly afterwards. Okay, why should be investigated and tested for COVID-19 infection? So this is, okay, sorry, yeah. Patient with acute respiratory illness. So, we will be wondering, like, why is that? We have a certain app here. I don't know what is the app used in India. I think my friend was telling me it is Arogya Sedu. So in the same way, we have apps here in this country, which when we walk into a public place, we show the app and they check the temperature even now. So that's because if you have a fever or a temperature of about 37.8 and cough and shortness of breath, and then we mark that patient as the person as a suspected case of COVID and any sort of other respiratory illness. And then if it's a COVID-19 confirmed, then we ask the person to be isolated for 14 days, even without the symptoms. And then Okay, and any adult patient with severe acute respiratory infection. So you all know these symptoms, and I just have to talk about the infection control precautions, but I'm just still talking to you about COVID-19 because I just want to give you some understanding before we go into that. Okay, so yeah, the definition: a contact is a person involved in any of the following. So who is a person in close contact? The person who gives a direct control without proper personal protective equipment and staying in the same close environment of a COVID-19 patient, including the workplace, classroom, household, or traveling together in close proximity with a COVID-19 patient in any kind of transport within 14 days, the onset of symptoms is considered. And yeah, let's go to the next one. Okay, so now we'll see what are the infection control measures, what we use, what we need to use. Sorry for that. There's a problem with the slide. Okay, so first what we do is early recognition, which is very important. So that's why we have the temperature checked and all that, and the source, because control the minimized chance of exposure. Then, as I told in the previous slides, application of standard precaution regardless of any patient, even if the patient has any respiratory infections or no, we always follow the standard precautions. And then application of transmission-based precaution, just as we said, read in the previous slides, pertaining to the disease, whether to follow the contact or the droplet. And then application of airborne precaution in case of aerosol generating procedures, like taking a swab or anything like that. Then we also managed the visiting access. So in the pediatric unit, what we generally do is we ask the parents to be, because usually the parents, both of them want to be with the child. So we restricted the visitors' access. We asked only the mother to be with the child or the father. And then monitor and manage ill and exposed healthcare personnel. We had many of the nurses and doctors who became COVID-19 positive. And then we managed, we had to isolate them and then train and educate the healthcare personnel and then implement environmental infection control. So early recognition and source control, how do you do this? Upon arrival and during the visit. So this is something which identify the patient at risk for having COVID-19 infection. And then, so immediately upon arrival, we do the rapid triage. When we do the rapid triage, we have something called visual triage questionnaire. So we gave them, because we can't be talking to them directly, we just give them a questionnaire and they have to fill in up like whether they were exposed to any red zone countries, or did they travel recently, or do they have any respiratory type infections. And then we provide supplies such as the PPE. We encourage them to use the sanitizer. We keep it at the entrance of the facility, in the waiting room. And then through the entire duration of the waiting, during the visit, we encourage them to use the mask and prioritization of the care of symptomatic patients. So this is what we do upon arrival. Then immediately isolate those patients with positive visual triage questionnaire. This is the questionnaire which I was talking to you about. We have a printed visual triage questionnaire, and if we see, we have a certain scoring system for that, and if we see that the person scores high on that, and then it's a positive patient, and then we immediately isolate them. And if admitted, we place the patient with a non or suspected COVID-19 if there's no availability of room, because during the COVID-19 we had severe shortage of space in the hospital, and we didn't have rooms. We had to accommodate even the corridors. And then airborne infection isolation rooms. So again, during COVID-19, we couldn't make use of all the airborne infection isolation room because it was all full. And then pending transfers or discharge, place a face mask on the patient, isolate him or her. And then when single rooms are not available, just as I told you, we will cohort the patient. That is, we'll put the patient with the same infection. So, and ensure that the healthcare workers are following and updated the PPE guidelines. So we have, just as I told you, the donning and doffing of the PPEs, the correct usage of PPEs. And Again, taking precautions when performing the AGPs, that is the aerosol generating procedures. So if performed, the following should occur. That is, the healthcare worker in the room should wear an N95 mask. The number of visitors should be restricted, and it should be ideally done in a negative pressure room, and clean and disinfect the room after the procedures. And then the infection control measures, as I said, all visitors should be actively assessed for fever and respiratory symptoms. That's why we had temperature sensors in every entrance of the hospital. So once a patient walks in through the temperature sensor, it will give an alarm, and then we will know that this patient has got a temperature. So we do the necessary standard precaution. And all visitors should perform frequent hand hygiene, avoid the movement and transportation of patient from one room to another, and using of disposable equipments dedicated to one patient. And then cleaning and disinfection of environment. So the routine cleaning and disinfection procedure using cleaners or water, and then frequently touch surfaces were also cleaned. So we had certain guidelines and protocols which the government had given us, and we were following that. So the magic bullet. So this is what we call the sanitizers, which was kept everywhere. Again, what we do is, I'll just to demonstrate. Okay, we have the sanitizer here. We take adequate amount, and then first we rub it this way, then the right hand over the left, interlaced between the fingers, and then again we do this, and then for the nails we do this, and then for the left thumb, the right thumb, the nails, both, and then we make sure that it's dry before we touch the patient. And donning, as I told you, the donning PPE with the following order. This is the order what we follow for donning the PPE. That's a gown, the surgical N95 mask, the face shield, and the gloves. So you can just, so these are the equipments what we use: the N95 mask, the goggles, the gown, and the gloves. And again, for doffing, this is the order what we follow. Okay, first we remove the gloves, then the face shield and goggles, then the gown, and last the mask. So this is what we follow here. Then we have certain administrative protocols, that is the healthcare worker training. We give the necessary training for the patients and the caregivers, and then early recognition of any respiratory infection. And we always, prevented overcrowding. We had all the consultation was through telephone. All our OPDs, that is outpatient departments, were through telephonic consultation, so that there's no overcrowding in the emergency department. And then monitoring our healthcare workers frequently, so doing the PCR and making sure that all of them are vaccinated. And then COVID-19 patients may be discharged based on the clinical resolution of symptoms and evidence for viral RNA clearance from the upper respiratory tract, with testing capacity permits for symptomatic patients, and then time-based strategy for asymptomatic patients, and the CT value for mild asymptomatic patients. And so when to discontinue the isolation is after 14 days of diagnosis, and there will be no need for retesting, because initially we were retesting, and then we were running short of manpower, because in the beginning we had 28 days of isolation for our house for our staff, or which was really alarming for us, because then after that WHO came up with the recent discontinuing isolation protocol, which said that after 14 days of diagnosis they are safe, and there will be no need for retesting, and then a repeat of swab after 14 days for immunocompromised patients only. And for asymptomatic patients with reactive result of CT upon diagnosis, all the patients with initial reactive RT-PCR value of less than 30 upon diagnosis, repeat testing is required. If the test is positive, then should be isolated for total 14 days, just like I told. And ending home isolation recovery. So after that, when finally when we it's like a herd immunity. So we were expecting that everybody will be positive. So then we encouraged home isolation, and we made sure that, because just as we have the Arogya Setu app in India, we have an app here which the patient can be traced with the app, like whether the patient is moving out of isolation and all that. And then after completion of the 14 days of total isolation, then we call the patient. We had call centers working. We still have it. And we call the patient and tell them that you're free of isolation and you can be going out now. So in summary, coronavirus infection can be prevented and an outbreak can be stopped through the active engagement of the decision makers, the healthcare professionals, the media, and the community. Be flexible, open-minded, and updated. Most important, stay safe. So these were some of the references, and thank you so much.
It's my privilege to thank our resource person for the much needed lecture for all of us at this right moment. As we all are fighting against the invisible enemy, hope this lecture is going to be a shield for us to protect ourselves out of this pandemic as well. Thank you, ma'am. We will go ahead and take some time for questions now. Just a reminder, please be sure to type your queries into the question box in your control panel. So it looks like we have few questions. And one of our faculty has asked, how many hours coronavirus will stay in dead patients?
In dead patients, yeah, I think I had a slide on that. Just a second. Oh, no, I think I need to go back to the slide. Just a second. I'll just show you the slide.
Sure.
Yes, Anand?
Yes, sir.
Ah.
So, Madam is
Yeah,
getting.
I cannot find the slide, but what I know is it can, in a dead patient, it can be active for almost 24 hours.
Thank you, ma'am. So there is another question, ma'am. How to disinfect the ventilator after extubating a COVID patient? Is it possible?
Yes, it's possible. Of course, we have to. And then during COVID-19, of course, we had challenges of, we didn't have enough mechanical ventilators, but we have certain infection control protocols, which we maintain for cleaning of mechanical ventilators. Like the disinfectants, what we use is as per the hospital protocol and policies, and that is what we use. So I can give you the resources if you want, but then I don't have the slides, unfortunately, but we have certain disinfectants which we specifically use for mechanical ventilators disinfection after using for a COVID patient.
Thank you, ma'am. Ma'am, there is another question. Okay, so which method of disposal is appropriate for disposing materials that is used for corona positive patients?
Yeah, for us in Qatar, what we do is incineration.
So thank you, ma'am. Ma'am, there is another question from one of our students. So is there any difference in the precaution measures between airborne infection and droplet infection?
Of course, we have a different type of precautions what we use for airborne precaution and for droplet. So we have the PP, but during the COVID-19, what we did is the PPEs were like all mandatory, regardless of being airborne or droplet. We were using all the PPEs, which is must. That is the gloves, the mask, and the N95 mask and the gowns, everything. But otherwise, for normal patients, what we have is droplet precautions. We have only the mask for the pediatric patients, and for the contact we use the gloves. But now when it comes to COVID-19, we had to use all the PPE regardless of the isolation.
Thank you, ma'am. Ma'am, there is one more question. So how long COVID-19 virus will survive on the surface after droplet? Maybe after the patient sneezes or coughs. How long will it survive on the surface?
As per the WHO precautions and the protocols, initially they said like it remains for 24 hours, and then later on they said like 6 to 8 hours on metallic surfaces and 4 to 5 hours on ground surfaces.
Okay, ma'am. There is one more question from one of our students. So they have asked that, is there any specific reason is there to follow the particular order of donning and doffing of PP? Is there any reason behind it?
Yeah, every
That is-
hospital has, yeah, so yeah, I got it. Yeah, every hospital have got different reasons. But why we do is like first when we told about the donning. First we put down the gloves. You know, when we are removing, we remove the gloves first because that's the most contaminated. As per the nursing principles, it is from less contaminated to more contaminated, right? So first we remove it's other way around. So first we remove the gloves, then we remove the gown, and then we remove the shield, and then we remove the mask. So that is what we use as per our hospital protocol for the donning and doffing order. I mean, I showed you the slides on donning and doffing.
Okay, ma'am. Ma'am, there is one more question. There are many questions are coming one
No
after
problem.
another.
No problem.
When you transfer a patient from one unit to another, what are the precautionary measures, especially regarding PPE, what the healthcare workers have to put on, and as well as what all the things have to be practiced on the patients during the transfer?
Yeah, during the transfer during COVID-19, what we did is we were isolating each unit separately so that there is less transfer and less transportation between patients to other area. But then in some circumstances where you have to transport the patient, what we do is we make it mandatory that the patient has a mask, and the healthcare workers are in all the PPEs, the gown and the double mask and all that when we really know that it is a COVID positive patient. So these were some of the methods what we were using, the measures.
There is another question as well. So does wearing double mask ensure higher safety?
It is if you have an N95 mask, because initially we had shortage in supply, and that time we were encouraging our staff to wear, 2 surgical masks, and because we didn't have N95 mask, we seriously had a shortage of N95 mask, and later. But I would suggest N95. If you have an N95 mask, that's the best. You don't have to go for a double mask if you have an N95.
Okay, ma'am. So one final question, ma'am, and we have troubled you enough. So the last one. So could you please say us about the third wave and what kind of research is going on right now and in other countries as well, and give us some health education about it as well.
Okay, that's a good question. So, telling about the third wave, we really need to know what variant of COVID-19 it is, because it depends on the variants, because we have different variants. Like in India, we had a different variant. In Qatar, we had a different variant. So it depends upon the severity of the variant. And then, the precautions are anyway going to be this, because if we could manage this so well, so we are confident that even if there's a third wave, if we follow the same precautions, the isolation measures and the social distancing and all these, of course, we can manage it well, but again, depending on the variant. So as of now, this is what we're just going to be optimistic and seeing like what holds the future.
Thank you, ma'am. Thank you for your patience, and the clarifications that you have given have helped us. And I hope so the students also have understood. So, okay, ma'am. So it looks like we have covered all our questions. Ma'am, would you like to wrap up?
Okay, yeah. So again, I would just like to say infection control is everybody's responsibility. So as being the infection control week, I would encourage everybody to practice hand hygiene always. And then just as I demonstrated how to do the hand wash, take at least 20 seconds when you hand wash, and then whenever possible, use a sanitizer or a hand rub. And as I always tell you, use standard precaution for any patient, regardless if the patient is infectious or no. Always use a standard precaution, that is wearing of gloves and mask. And And it is, again, everybody's responsibility. Infection control, maintaining the infection control measures is everybody's responsibility. So as a nurse, you have the major responsibility of following it. And here we have link infection control nurses in our units here. They are, in fact, we call them spies because they check on our nurses whether they are hand washing, and it's for the patient safety, as it is one of the international patient safety goal. Thank you, everyone.
Thank you, ma'am. That was so informational. So now I call upon Mrs. Jamie Jansen, Assistant Professor, to express our gratitude.
Good afternoon. Good afternoon to one and all. I deem it a great honor and privilege to propose the vote of thanks today. Let me give glory to the Almighty God for making today's webinar a resounding success. First and foremost, I thank our special guest, Ms. Susan Shaila Abraham, Director of Nursing, Hamad Medical Corporation, Doha, Qatar, who despite her busy schedule has found time to share her valuable knowledge with us today. Thank you, ma'am.
Thank you.
Thank you, madam. Great thank you to everyone. We appreciate you being here. Thanks again for joining us today, and we will see you next time. E-certificates will be emailed to registered participants. You can watch our webinars anytime on Sarvodaya College of Nursing YouTube channel. Kindly like and subscribe our channel. Thank you, one and all.